Good morning, everyone. Welcome back to Nature's Healing Remedies, your pathway to wholeness. Can you see on the screen what you're going to need today? As a reminder, the supplies that's going to be needed if you're going to participate in the program, hydrotherapy. 2 basins, one with hot water, one with cool, 1 basin with boiling water, and a few drops of essential oil to give that nice smell. A paper cup of frozen water, washcloths, and a towel. Are we ready to go? We'll now have our prayer by Dr. Simmons.
Thank you, Sister Trott, Health Ministries Director for the Devonshire Church, for that welcome. Truly, we are happy that God has permitted us to come together again this morning to hear some more valuable information about how to treat these wonderful bodies that God has given us. And we thank God for Dr. Gibbons' information. Before I pray this morning, we'd like to extend, though, our sympathies to one of our members, Sister Pauline DeShields, in a special way, and family, her sister-in-law, who may be a part of this group this morning. We were saddened to hear of the passing of Brother Gary DeShields, and our prayers, of course, are with the family at this time in a very special way. We have the precious hope that he embodied, the hope in the resurrection of Jesus Christ one day soon. So we take courage amidst our tears. We take comfort in the promises of God. Let us bow our heads as we pray now and God ask God to bless our gathering and bless our presentations this morning. Loving Father and gracious Savior, you have endeared yourself to us, O Lord, through Jesus. Jesus, you came and you made it abundantly clear of the extent of God's love for us, his creation, and you made it possible that we could have everlasting life. But until that day of your return, we are thankful that you have empowered men to study the bodies and the workings of the bodies and what can happen with us through the utilization of natural remedies and other medicinal remedies to treat us. And so we pray that you'll be with Dr. Gibbons as he continues to share with us this valuable information. And we would not forget, oh Lord, to present to you Sister Pauline and her sister-in-law and the family members who are now mourning the passing of a loved one. We know that one day soon, there's going to be rejoicing in the glorious reunion. And so, Jesus, today we want to thank you and pray for your presence, for your guidance in all that we do. Be with this technology in a special way. Jesus, in your name we pray, amen.
Good morning, everyone, and welcome back. I trust that you have had a wonderful weekend thus far. And now it's our quiz time for session 7. And let us begin. Question number 1. Hydrotherapy is the use of water as a solid liquid or steam internally or externally in the treatment of disease or trauma. That answer is true. Question number 2. Hydrotherapy has no harmful side effects, no resistance to antibiotics, provides the therapeutic benefit of touch, improves microcirculation, and improves mobility of white blood cells. That answer is true. Number 3, exercise, hydrotherapy, deep breathing exercises, and eating a whole plant food diet can increase the circulation of blood in the body. That answer is true. Number 4, hot water constricts, closes blood vessels, while cold water dilates, opens blood vessels. That answer is false. Number 5, a cool water temperature is from 70 degrees to 80 Fahrenheit, while hot water temperature is above 103 Fahrenheit. That answer is false. Number 6, hydrotherapy can increase white blood cell activity by 200 to 300%, red blood cells by 20 to 30%, and hemoglobin by 10%. That answer is false. Number 7, the artificial fever range for addressing colds, influenza, sore throats, lupus, and pain anywhere in the body is from 100 to 103 Fahrenheit. That answer is true. Number 8, an excellent hydrotherapy treatment that will relieve congestive, headache, and chest and pelvic congestion is a hot arm bath. That answer is false. Number 9, the water temperature in a hot foot bath should start at 102 Fahrenheit and gradually increase to 110 Fahrenheit. That answer is true. Number 10, always avoid resting after a hydrotherapy treatment. That answer is false. Number 11, bronchitis, pneumonia, influenza, constipation, abdominal pain, gas, bloating, muscle tension, and insomnia can be relieved using hot fermentations. That answer is true. Number 12, a short cold bath will increase muscle work capacity, turn up the skin, increase metabolic rate, thyroid function, levels of hemoglobin, red blood cells, and white blood cells. That answer is true. And number 13, the cold shower is one of the most powerful of all tonics. That answer is true. Number 14, hyper or hypothyroids, nervousness, exhaustion, depression, sluggish circulation, general weakness, lack of endurance, anemia, alcoholism, drug withdrawals, and insomnia can be relieved using the cold mitten friction. That answer is true. And number 15, the contrast bath speeds up the healing of infections, sprains, strains, swellings, trauma after the first 24 hours, and fractures, reducing pain and edema. That answer is true. And number 16, coughing, nasal congestion, throat congestion, dry throat, and throat inflammation cannot be relieved through steam inhalation. That answer is false. And number 17, painful joints, bursitis, painful muscles, acute neck, and lower back pain can be relieved using an iced massage. That answer is true. And number 18, for someone with a fever of 99 Fahrenheit to 103 Fahrenheit, you want to create a higher artificial fever. That answer is true. And number 19, a hot and cold contrast shower could be used at the first sign of a cold. That answer is true. And that concludes our quiz for this week. And do not forget to put your scores in your score sheet. Thank you and have a great day.
Greetings, everyone. Our presenter today is Dr. Leonard Gibbons. He's a graduate of Loma Linda University, where he completed both his Master of Public Health and his Doctor of Public Health degrees. Dr. Gibbons also attended Oakwood University. Additionally, he completed programs with the Australian College of Phytotherapy, Banning School of Massage, and UG Pines Institute. Formerly the Wellness Coordinator of the Bermuda Hospitals Board and the Health Promotions Coordinator for the Bermuda Government Department of Health, Dr. Gibbons is currently the Health Ministries Director for the Bermuda Conference of Seventh-day Adventists. And he works at Bermuda Wellness and Outreach Center as a lifestyle intervention specialist. Dr. Gibbons focuses on lifestyle medicine while working with patients and clients in conjunction with their primary care physicians. Dr. Gibbons is known for providing wellness education and lifestyle change programs for churches, businesses, several organizations, and the general public, always using his expertise in public health nutrition, in dietetics, herbal medicine, alcohol and drug counseling, massage therapy, hydrotherapy, public speaking, and lifestyle medicine, including God's natural remedies, all as a framework for health and healing. Dr. Gibbons is married to yours truly, Dr. Rosamond Williams Gibbons, a career teacher educator working in the Bermuda government school system. She too holds a graduate degree in global international public health from Loma Linda University. That's in California in the United States. The Gibbonses, we are blessed with 2 children, now young adults, pursuing careers of choice, after having accompanied their parents during many years of community work, volunteer work that is. Online students, listeners everywhere, without further ado, I present to you a committed healthcare provider, lifestyle intervention specialist, and my husband, Dr. Leonard L. Gibbons.
Okay. Good morning, everyone. Good morning, everyone. I trust you've had a good week. Sorry about the question and answer session. We will address that next week. Well, today we're looking at this whole question of hydrotherapy. Now, hydrotherapy is one of the most effective, safest therapies we have. And so we're going to take a look at the use of water in the treatment of disease. And this, you see this picture at the front here is actually an example of one of the most safest, yet easy to perform of all hydrotherapy procedures. And as you can see, there's a little boy. He's actually sitting in the chair, and his feet are actually in hot water. and he's wrapped up with a sheet and then a blanket that goes over him. You can see his mother is holding a towel, face towel to his head. And so that's all part of this whole procedure. And we'll take a look at an example of utilizing the hot foot bath along with other hydrotherapy procedures. Well, first of all, what is hydrotherapy? Well, as in the quiz, it's the use of water in any of its three forms, a solid, a liquid, or steam. It can be used internally or externally for the treatment of disease or trauma. I guess why use it? Of course, it's inexpensive. It's very accessible. No side effects. Everyone's got a tank. When used appropriately, requires simple equipment and has the right properties to function as a therapeutic agent. So those healing factors. How does it benefit? This is a whole list of them. Physiologically, it works with how the body functions. It can focus on one area of the body without compromising the health of another part of the body. And this is important. Let me give you an example. There is a medication called nitroglycerin, and it is designed to dilate blood vessels. These are individuals who may have compromised heart function. They've got reduced circulation to the heart muscle. As they start to move and exercise, they may experience pains, chest pains, or what have you. And nitroglycerin is put under the tongue, and it helps to open up those blood vessels. So relieving that pain, getting that blood flow to the heart. But nitroglycerin not only opens up the blood vessels in the heart area, it opens up blood vessels everywhere. So someone could actually end up with a headache. So it's affecting the whole body, multiple parts. But with hydrotherapy, we can zero in on our attention to one area and not creating an effect in another area where the blood vessels are dilated, which could be not best. So hydrotherapy can be very targeted to address specific areas. Harmful side effects, no harmful side effects. Of course, no resistance to antibiotics. And when antibiotics are utilized, overused, they create a situation where the body can become, actually the bacteria can become resistant to these antibiotics. And now we're coming up with strains of these bacteria that the antibiotics are not able to fight against. They have changed and become resistant to these antibiotics. And so what we know is when we use water therapy, it doesn't create any situation where something like this could happen. Of course, the benefits of touch, just coming close and being able to touch people in a personal way has a healing effect. The white blood cells move more efficiently. They are attracted, chemical attraction, and phagocytosis, where these white blood cells engulf the germs. So these are some of the benefits of water, just using water can have for us. So now, natural means used in accordance with God's will bring about supernatural results. And this is what we believe. We ask for a miracle, and the Lord directs the mind to some simple remedies. And this is taken from the writings of Ellen G. White, who we've been talking about through this whole natural remedy series. So simple things can bring about supernatural results. And we're just going to talk about some of them. Now, of course, we've mentioned this statement before. There are many ways of practicing the healing art, but there's only one way that heaven approves. God's remedies are the simple agencies of nature that will not tax or debilitate the system through their powerful properties. So we don't have the side effects that could be harmful to the body by utilizing natural remedies. And what better remedy to use than something that's in all of our tanks? So water is what we're going to take a look at. Now, in order to have good health, we must have good blood. And for the blood is the current of life. It repairs waste, it nourishes the body. When supplied with proper food elements and when cleansed and vitalized by contact with air, it carries life-giving vigor to every part of the system. Now, a part of getting that vigor and that circulation to all parts of the system, water can be an effective tool for helping that communication, especially for individuals who are not mobile, who cannot walk, or they're not able to walk, or they're recovering, they have major health issues, or they have aches and pains, and they're unable to actually move as they would like to move. Well, we could actually use water to actually get that blood moving. So water can be a powerful tool to greatly increase circulation, just like exercise increases circulation. Water properly used can increase circulation. And we have been talking about this whole thing that perfect health depends upon perfect circulation. The more perfect the circulation, the better will be the health. And congestion is central to disease. So if there is congestion, more than likely there is some form of disease. And just about every form of disease you can think about, there is circulation at the core of it. Either the blood is not getting where it needs to go, it's congested in one area or another. The circulation is not as efficient, so we get a buildup of toxins. We don't get that exchange of oxygen and good nutrition from the blood. And you don't get the body's working in a way that enhances the getting rid of toxins and poisons and taking on fresh blood and oxygen. And this buildup of this poor circulation is fundamental to most of the health issues. So water is a powerful tool for increasing circulation. And when we get to talk about all of the health issues that water can benefit, the important thing to remember is because using water can enhance circulation in a very dramatic way and can bring in blood, white blood cells, it can enhance detoxification or getting rid of waste products. You can see why it can benefit just about every health problem people may have. So this is an important remedy. You want to make sure you learn how to apply and apply it well. And as I said already, perfect health depends upon perfect circulation. The more perfect the circulation, the better will, of course, the work be accomplished in the body itself. So it's all about circulation. Now, what improves circulation? Now, if you see the picture to the right, that's actually one of my good friends who is standing there. And I am in that box, as you can see there. There's a cool cloth to my head, and there is a towel draped around my neck, and I'm inside a steam cabinet. And it is a type of steam treatment where underneath the seat, which you can't see, is a little tub, so to speak, a little canister where water is poured in, and there's a heating element in there, and it creates steam. So what is happening is the steam is filling up all inside this cabinet, and that steam is heating up my body, increasing my temperature. And so my body in response is sweating, and the white blood cells are increasing. The circulation is being improved. And so he keeps my head cool, and periodically he puts a thermometer in my mouth, and that purpose is to check my temperature to see how it's moving over time. And at the end of the treatment, he will open up the cabinet, and it's got a door so that all the hot air can go out. And then we finish off with a cool shower, dry off and rest. So this is actually an example of one of those treatments. Of course, when we talk about circulation, as I've been talking about, exercise improves circulation, water therapy improves circulation, hydrotherapy, deep breathing, and eating largely of whole plant foods rather than high fatty foods, which will tend to cause the blood vessels to, red blood cells to clump together, stiffen blood vessels, slow circulation. So this high intake of lower fat foods, smaller amounts of foods that have fat, all of these things help with improving circulation. And so we're going to talk about good old hydrotherapy, okay? So what impairs? Of course, the body is chilled, and the blood constricts to the trunk, your extremities are cold, and you're getting all goosebumps. But so the blood is being channeled to your midsection here, and congestion can result from that. Constricting clothing can impact your circulation. Irregular eating habits. And as I talked about, high-fat diets, stress itself, all of these impair circulation. So what we're going to focus on today, though, is hydrotherapy. So why is circulation important? The body's transport system. It's all through the circulation, your red blood cells, your plasma, dissolved materials, all of that goes through that. Oxygen delivery, energy, waste removal, the immune system, the white blood cells. In fact, 65,000 miles of blood vessels. So we've got this blood vascular system going throughout our body. So in anything that can enhance that circulation, that exchange of nutrition and waste products and oxygen and immune cells will enhance recovery. Of course, our skin is the largest organ of the body, and it's essential for cleansing and detoxifying. It protects, it homeostasis, it helps to create this balance. It allows for absorption and immunity. Our white blood cells are a part or inhabit, there are blood cells that inhabit our skin. And so when we get water treatments, they have an ability of bringing the blood to the surface, bringing the flow of oxygen and carbon dioxide and waste products where the body can actually help detoxify. In fact, we even know that some of the heavy metals, which are actually toxic to us, can be taken out through the skin. So less work for the kidneys and for the bowels to get rid of toxins when those toxins can be transported through the skin, and we can wash those toxins away, decreasing the load on our eliminative organs, our liver and our kidneys and our bowels. And so this is an important tool for helping to, in that fashion. Now, here is water. Depending on what we want to accomplish determines what level of temperature the water will be. Very hot on one extreme, very cool on the other. Okay, now you can see neutral, 94 to 97, and neutral is sort of more of a relaxing. And you got tepid, you got cool, you got very cool. Now hot opens up blood vessels, it dilates blood vessels, while cool water constricts or causes the blood vessels to get very, very, very small. I guess you can call it small, from opening up to closing, opening up and closing. And this example you see in the picture is an example of a contrast. And we'll talk a little bit about that as we go along, but as you can see, this person's feet are in a bucket of ice and water. And there's another bucket, and his feet will go from the cold bucket to the hot bucket, to the cold bucket, to the hot bucket. So this is a contrast procedure, and we're gonna talk a little bit about that, and you'll get a chance to actually do that, a contrast procedure. So let's start with the hot foot bath. Now, it is one of the most simple and safest of hydrotherapy procedures that you can do. It can be helpful in a number of ways. And so let's just take a look at it. What's the purpose? Well, it provides general warming of the body. So if you're a little cool, just putting your feet in very hot water using the hot foot bath would help warm you up. Sometimes we use a warming procedure to prepare a person for a cool procedure. You do not utilize a cool procedure or cool water with someone who is actually cold already. It's not going to work. They must first be warmed up. So any cold treatment should be preceded by a warming of the body. Now, especially if we're talking about a cold procedure that involves the whole body, all right? That takes a lot of heat from the body. And if you're not hot at the beginning, it will be counterproductive. So it provides general warming. It increases white blood cell activity, stimulates circulation, relieves congestion. And as I started out, perfect health depends upon perfect circulation. So congestion results in dis-ease. A headache is an example of something that is can be congestive headache. Sometimes our head, congestion in the chest, cool congestion in the pelvic area, pelvic cramps, So all of these are an example. These are examples of congestion. And we're going to talk about how hot foot bath can help with relieving congestion, stimulating in circulation, red blood cells. It can also help relaxation. Sometimes we're tensed and we're tight. And actually the tension is a part of congestion. So think about it. People who are tense actually have some degree of congestion. And so this hot foot bath helps with relaxation. So your circulation, your congestion, your relaxation. Relieve inflammation. And inflammation is, when we think of inflammation, if you smash your finger in a door or something like that, it becomes red, it becomes warm, becomes swollen, it's painful. All of this is an inflammatory reactions. And a hot foot bath can help to relieve inflammation. Lower blood pressure. You think about it, a hot treatment, a general hot treatment can help equalize circulation. So if there's congestion, and we're getting the circulation to move to the extremities, your arms, your legs, and this overall movement of blood to the extremities will have an effect of lowering blood pressure. In fact, if your blood pressure is elevated and you had a basin and you put your arms in hot water in the basin, for 5 minutes or so, and take it out, dry it off, I can actually lower your overall blood pressure. We're helping to bring circulation to your extremities and the smaller blood vessels. And as a result of the general increase of circulation, it helps to lower the overall blood pressure. So, headaches, indications. Congestion in the chest, congestion in the pelvic, nosebleeds, insomnia, or preparing for a cold treatment, as I talked about earlier. So, there are reasons you can utilize the hot foot bath. And diabetes. The bath shouldn't be more than 103 degrees. Individuals with diabetes may have poor circulation, poor sense of feeling in their feet. And if someone doesn't feel something, or the circulation is very poor, giving them very hot treatments or very cold treatment is not a good thing. So it'd be more like warm and cool for someone that has impaired sensation, circulation, edema, or disease called Berger's disease, and all of these involving circulation issues. So it's important that you're aware of these things, and if all is well, these contraindications or cautions, you can go ahead with hot foot bath. Now, what do you need? You need a bucket, you need basins, face towel, pitcher, hot water, ice water, blanket, sheet, thermometer, especially if your water thermometer, you're testing the temperature of the water, a chair or a bed if they are lying down, okay? So that's what we need. Now, as I talked a little bit about diabetes, if they have a history of diabetes or blood vessel disease in the legs and the feet, one could check for sensation, check for foot pulse. The pulse is well, sensation is well, then people can tolerate heat and cold because they're feeling that, all right? So the person can be lying or sitting, properly draped, have the water temperature between 102 and 110 degrees. Okay, so you start at the lower temperature and you can increase it. You assist the patient. Now, they would basically have just shorts on or underwear on in this case. That could be a good dressing. We would drape the seat with the blanket and then drape the blanket with the sheet. And then the person would sit in the chair, and in front of them, you would have the bucket. All right? And so they are sitting in the chair, their feet are in the bucket, and they're sitting on the sheet, which is covering the blanket, which will ultimately be, wrapped around them. Be sure the drape covers the tub. Add hot water from time to time to increase the temperature gradually to 110 degrees. Now, another way of doing it is you have the temperature warm to begin with. And on the side, you have a kettle with boiling water or a pot with boiling water. And then you take your hand and you put your hand on the side of the feet and you move their feet to one side. Excuse me. Then you are pouring water. And as you're pouring water with one hand, you're swishing the water around in the tub with the other. And you're slowly adding the water and you're just communicating with the individual and say, just let me know when it's hot enough for you. All right, so you want to add the heat until it's just, it's hot. They can stand it, but it's not too hot. Now, if they are diabetic, you want to make sure that you use the bath thermometer to make sure that the temperature doesn't go above 103, okay? But if there are no issues with circulation and feeling, the pulse, they're not diabetic, they don't have these health issues, you can just pour the hot water in, all right? And they'll say, enough, it's hot. All right, and then you cover the tub again with the hot water. All right, so this is the process you go through. Now, when add an additional hot water, this is about every 3 to 5 minutes. The water starts cooling down. So every 3 minutes, 3 to 4, 5 minutes, you put the feet to one side, as I said again, and you add more hot water. So you make sure you keep this water as hot as they can stand it, or hot based on whether or not they have diabetes or poor circulation, okay? The water should be hot to tolerate, no more than 103 if diabetic, and continue for 10 to 30 minutes or longer, depending on the purpose of the treatment. Now, as you're going along in the treatment, one good sign that you're getting a good reaction is you start to see beads of sweat on the head. And when you start to see beads of sweat on the head, that's when you want to wipe off the head, the forehead, with a cold towel. So you have a basin on the side, and that's where you have your ice and water. All right, so you've got your ice and your water in there. And so you just wipe the head off, wring it out, and you could actually just put that there depending on how hot they are. Generally, this is not a very, very intense treatment. What would be more intense is like the steam cabinet that I started out, that picture, where you've got this constant steam and the steam is affecting the whole person rather than just the hot foot bath that just affects your feet. So that would be more intense, and we would probably be checking their oral temperature, and more cool to the head, and maybe even we would even sometimes have a fan. And as they're starting to sweat out, the fan is helping in the cooling. So you've got the coolness of the water, and you've also got the fan, and that's in the intense, and they'll also be drinking water. Okay, so this is not that intense. So not that you cannot have water, you can in fact have hot like peppermint tea if you want to help to make it a little bit more intense and getting them to drink the water. But the hot foot bath is not a very intense treatment, pretty safe treatment for most people. And in fact, can be quite relaxing, because what you're doing is essentially you're equalizing the circulation. So people who are just not feeling themselves, I'm not feeling quite well, I'm not quite myself 100%, general aches and pains, you could do this simple procedure, and it can bring a tremendous relief and giving people a sense of well-being or positive sense of well-being. Okay, so check reaction for perspiration and wipe the face with the face towel dipped in ice water, as I talked about already. Now, you can wrap the head with cool compress when sweating begins, and renew every 2 minutes to give water through a straw if sweating is continued. Now, when the treatment is finished, you pour cold or ice water over the feet, remove the tub, and rub and dry thoroughly. Now, if they are sweating a really lot, then maybe a good thing to even just get a shower, cool shower. Or you can use the cold towel, wrung out, and just briskly rub across the legs, the arms, but that way, or just the towel, just a shower. They can dry off, they can go to bed. Now, it all depends on how intense it is. It's not a very tense and not a lot of sweating. The cool water pour on the feet, drying off the hands, off the feet may be enough, but you can always end with a cool shower and a rest for 10 to 15 minutes, generally 30 minutes or even longer, but it all depends on how intense the treatment is. Okay, now, I said alcohol sponge is another way of cooling over the whole body. Or hot foot bath is commonly given in conjunction, of course, with other methods. All right, so headaches, sore throats, you can actually put dry mustard or other irritants to the water that will, a little cayenne or something that will intensify the heat. 1 teaspoon per gallon of water. Now, of course, these are the amazing benefits of one hydrotherapy treatment. Is called the hot fermentation. Now, as you can see, this person is lying down, and actually we're going to see a demonstration of this particular treatment. You can't tell what's actually happening, but we'll get into that as we go along. It increases white blood cell activity, 200 to 300%, the mobility of white blood cells, red blood cells, 20 to 30% circulation of white hemoglobin up to 5%, relieves internal congestion, shifts the blood flow to the skin. This is sort of a reflexive. You apply heat and the body tries to cool itself down, and it brings the blood to the surface. And so this internal congestion and pain in a particular organ, applying heat externally actually helps relieve that internal congestion, increases circulation to the external, peripheral, brings the white blood cells in place. Of course, it assists in removing waste products, increasing sweating, increasing temperature. All of these are good things that happen. So there are 3 ways of heating up fermentation. Now, fermentation is a moist heat pack. Okay, and in this example, you see the individual. Well, in this example, in the picture, they took a towel, turned it around, and they dropped it put it into hot water. Let's say hot water is boiling, but the 2 ends that they're holding on are dry. And then they wring that out, and then they're applying that to the skin. Now, it all depends on how hot that cloth is. If it's very hot, what we do is we actually would put a dry towel first over the area, and then we would put the moist heat, and then we would put a blanket on top of that. All right, so you have 3 layers: the layer of the dry towel, the layer of the hot moist towel, and the layer of the blanket to help hold in that heat. All right, now preparation methods, the boiling water method, this is an example here, steaming method, where you actually have you can have a pot and you have water, and then you have a rack in it. And so the rack is above the water, and it has holes or ways for the steam could get up. And then you have your towels, which are wet, dried, and rolled up. And so these rolls are put in the towel, in the pot, put a top on, and then you just steam that. All right. And then when they are hot, you use like mitts, over mitts. You take those out, you apply the dry towel, and then you apply the wet towel. And you'll see what that looks like. The next method is the microwave method. And this method, you actually, you have a bag, plastic bag, and you have the towels, it's wrung out, rolled up, and then you put that in the microwave. The bag is not completely sealed because you want to get some exchange of air in that, and that will get very hot also. So you can put it in the microwave, you can steam it over a pot, or you can have boiling water that you dip it in and bring it. So those are three methods of getting this moist, hot pads we call fermentations. So this is what it looks like in the steam here. There are the rolls, and then the heat on the bottom and the steam, and is heating up those fermentation pads. So completely wring out 3 to 5 large bath towels or fermentation pads in water. Okay, place the towels or pad on the grid of a large canner. That's a canner or large pot in this example. Place enough water in the canner below the grid and boil it for about 20 minutes. Towels or pads should not touch the water. So they're moist, wrung out, and so they hold that steam. You do not want water dripping from it. Okay, so what do we use it for? You can relieve pain, joints, nerves, muscle, and internal organs. For back pain, for muscle spasms, pain from nerves, joints, and muscles, arthritis pain to the spine 3 times a day, followed by heating compress. A heating compress is just, it's sort of like you would give you example if you were doing like chest. It's actually like a moist towel, like a moist, like a t-shirt that's wrung out, and then that's put on. And then a warm, like sweater is put on top of that. It's initially cool, but then the body responds by making it actually warmer. And so actually you're prolonging the impact of this heat between treatments. Okay, reducing congestion of the internal organs, chest congestion, bronchitis, pneumonia, influenza. This was the treatment that was used back in the influenza pandemic, that one we talked about before, where thousands of people, millions of people died around the world. And the Adventists, Seventh-day Adventist lifestyle centers, they were using these moist packs over the chest, the neck, for this condition. Constipation over the liver, twice a day, followed by heating compress. Abdominal pain, gas, bloating, spasms. So any of these pains and congestion, hot packs, hot fermentations are very, very good indication for helping relieve these conditions. Important consideration, make sure that the room is warm and free of draft. You don't want cool air blowing in. This could counteract the real effect of the treatment. You do not want people to have a treatment and then step on a cool floor. Not a good thing. You want everything to be warm, nice temperature. And if the floor is cool, or you want to make sure you put towels down, dry towels or anything like that, but you want the room warm and you don't want it drafty. Okay, this is important. Consider the age and vitality of the patients. People who are very young and very cool do not tolerate very cold or very hot treatments or prolonged extremes. We've given you some guidelines in terms of younger, older people, but older people generally do not tolerate too extremes in temperature. So you want to start with more cool and warm rather than hot or cool, and adjust as you go from one treatment to the second treatment. People feel comfortable, it's not too intense, and then you the additional treatments, you make it a little warmer or a little cooler to tolerance. But younger people can tolerate heat and cool, so they can tolerate the more extremes in cool and hot, which tend to produce a more vigorous and beneficial treatment. Protect the mattress if it's on a bed. So put a plastic on that first, and then you have your blankets or whatever else you're having as a part of the treatment, so that if there's water or anything that gets on it, doesn't wet the mattress. Keep towels under the fermentation dry. Okay, so whatever is in contact with the skin should be dry and not wet. If it's wet, that can create undue burning. Okay, so nothing wet. Make sure the skin is dry. The skin is dry also between fermentations. We'll get to that. Keep the towel dry under the fermentation. I mentioned earlier about the dry towel. Contact with the skin, and then the fermentation on top of that, all right? And so make sure that towel is dry. Place extra padding on the bony prominences. So if there's an area where there's a bone, make sure you put extra towel padding there, because you don't want the person to burn, and that's a critical piece. Hydrate. So make sure that they're drinking water periodically. They start perspiring. You have water in a straw so that they can drink in that water. And generally, the water is not cold. We can generally cool or warm. So that's what you want to make sure you have. Okay, next, always wash the hands before and after treatment. Okay, explain simply to the patient first what you're going to be doing. And this is an example of what it looks like. You've got the hot foot bath with the feet in. You've got a fermentation on the back, fermentation on the chest, and compress on the head. Now, this is a complete fermentation. Revulsive. We're going to talk about what this means. This is a more elaborate form rather than just one fermentation. This has a fermentation in the back, and also it has the hot foot bath, and then the cool to the head, and then they'll be covered with a sheet and a blanket. So this is an intensive fermentation that can be very beneficial. All right. So you've got the blanket, you've got a sheet, you have a pillow, large bucket, oral thermometer, got towels, water thermometer, blood pressure cuff and stethoscope we may use depending on condition of someone, fermentation pads and covers, large kettle, basin, ice, mitts, which can be used or hand towels, and 1 or 2 compressed cloths. So you're going to take a look at what that looks like all together. So have all the equipment ready, have blankets on the bed or table, then place sheets on top of the blanket. Take the patient's temperature, record it, record blood pressure. Sometimes we don't usually do that depending on whether the person has hypertension or they're much elderly, or we're just doing a gentle treatment. We don't necessarily go through that, but it's based on condition of the patient. Have the patient disrobe, have the patients lie on the sheet and wrap the blanket completely around the patient, exposing his head. Prepare the water in the buckets, 1 or 4, fill the buckets only half full because you're going to add more as we go along. Place your hand under the patient's feet as you lower their feet into the water. Completely wrap the bucket and lay it with the sheet and blanket. Now you're going to see this all done. All right. Okay. Cover the part to be treated first. Use intensity of heat as an indicator by the patient's skin condition and the fact to be desired. Apply the fermentation to the area as indicated. If it's to relieve congestion, extend over a large area. If it's a local, just a little short, a small area. Make the fermentation the size of the area. You can put one out of the back as you saw, and apply 1 or 2 fermentations across the chest. Leave for 5 minutes, 3 to 5. When it's comfortable, then change. As I said, you protect the sensitive parts. You lift the fermentation, hand firmly over the towel to remove moisture if unbearably hot, and you will see that in our demonstration. Necessary, place another towel between the fermentation and the patient, placing the dry towel next to the skin. So you're applying this dry towel, you apply the heat, and they say it's hot. Well, one thing you can do, you can lift it all and rub, or you can add another layer of the another layer of dry towel, okay? Place the towel between the fermentation, place the dry next to the skin, apply the cool to the head, 3 fermentations unless otherwise indicated, and then have cool between each of those treatments. All right, dry the part before applying another fermentation. And after the last fermentation, use a cool mitten friction over the entire body. So we're going to demonstrate that. So leave the patient with the dry gown, sheet, and blanket so they can rest. Their pain to tolerance, omit cool and extreme pain. And warm alcohol may be used to also cool the patient. All right, so we're gonna take a look at a...
Hi, welcome to Hydro for COVID. My name's Renee, and today I'm going to be teaching you how to do hot fermentations to somebody's chest from your own home. So today I'll be doing hot fermentations to my husband's chest in our kitchen because it's close to the microwave. So you don't need fancy equipment for this or special hot fermentation packs. I'll show you the equipment that you need and you can easily do it in your own home. So you'll need somewhere for the patient to lie. I'm going to use a massage table today, but you can use a bed or a recliner chair. You'll need a couple of sheets. You'll need a mattress protector or a waterproof covering, about 10 towels, full-size towels, and a couple of small face washers or the cold friction mittens, and a bowl with some ice, as well as a nice warm blanket to pop over the patient. And of course, you'll need a nice thick plastic bag for your towels that will go into the microwave to become your fermentation pads. Okay, so we will also be utilising a hot foot bath, so having the feet in hot water during the fermentations treatment, just to kind of help get the body temperature up. So found this in the garage. It's a good sized tub for 2 feet, not too deep, but we'll fit 2 feet in it. Function over fashion, people. I know it's not pretty, but it's gonna work. Hot fermentations to the chest are good for somebody who has coronavirus or somebody who has any other cold or flu. that is attacking the chest area. So if somebody has bronchitis or even if they're asthmatic, this is a really great treatment to do as a lung tonic. Really helps to increase the circulation to the area and of course bring those good white blood cells that are going to help fight infection. Next, you want to get your full-size towels, wet them thoroughly under some cold water so that they're completely saturated. Then you want to wring out as much of the water as possible. You don't want your towels dripping wet, so really use some elbow grease here, get into it and wring those towels right out so that when you're holding it up, it's not dripping any water onto you or the patient. Okay, so the towel has been wetted. It's been wrung out so that it's not dripping, but it's still very heavy and moist with the water. We're going to go ahead and put it in our plastic bag, tie that off and pop it in our microwave. So it's good to fold up your towel so that you can basically lay it out underneath the patient and just fold it out so that it's ready to go. So fold it up nicely, first scrunch in the bag, it'll make it more difficult later. Good to not entirely seal the bag off, just so that air can escape so that it doesn't blow up like a big balloon. So just a loose knot, leave a few air holes. If we set the timer for 4 minutes, this is basically how often the fermentations on the chest need to be changed. So it'll be a good alarm clock to know when you need to put the next one on. Ready to go. Okay, and last but not least, my lovely husband helping us out with the treatment today. So your patient should just be in nice, comfortable clothing. Obviously their shirt's going to need to come off, but some comfortable shorts or track pants. If they've got long pants, just get them to roll up the ends so that they don't get wet in the hot foot bath. So place the patient down on the bed in a comfortable position, bring along the hot foot bath and place their feet in the water. It should be at about 40 degrees Celsius and make sure the waterline is just above their ankle bones. All right, let's get started. So you want to make sure there's no drafts or cold air coming into the room. Make sure the patient remains warm throughout the entire treatment. We drape a sheet over their feet so that the temperature in the hot foot bath can stay more constant, as well as placing a blanket over them so that their entire body stays nice and warm. When you're putting the first fermentation pad down, you're going to lay it along the spine. Make sure there's always a nice, clean, dry towel between the fermentation pad and the skin. And if it gets too hot, just lift up and give it a few seconds to cool off a little bit. Check the temperature of the hot foot bath every now and again. It'll cool off initially. Add some more hot water to make sure it remains at temp throughout the entire treatment. All right, about to do our first cold mitten friction. So if you've got little mittens, they're fantastic. If you've got a face towel, you can sew up one end and the other. So essentially you've just got a hole to stick your hand in and use as mitts. Otherwise, I've just got the face washers here at the moment, so if you grab 2 of those, they'll work just as well as your cold mittens for the moment. All right, there's our next bag. Let's see how it goes. So the skin should be nice and pink and hot now. Which, Dan, are you feeling hot? Yep, beautiful. All right, let's get some cold onto it. So you can pull back the blanket and take off the first lot of fermentation pads. You want to get the cold mittens on fairly quickly so they've been dipped in ice cold water and wrung out, and you can see this is normal speed, so you can see that I'm working fairly quickly over the area. It's nice and red and blotchy, circulation's really gotten going. And you want to do that for about 30 seconds or so. Then place a dry towel back over the chest and apply your next fermentation pack from the microwave. Make sure they're nice and warm and steamy. And again, if they're a bit warm, just lift them up until the patient is comfortable. Wrap that up and cover the patient back up with the blanket. You want to leave the fermentation pack on the back there for the entire treatment, but the fomentations on the chest, you want to change them over 3 to 4 times. So fomentation pack for 4 minutes, cold mitten friction for 30 seconds, and hot pack for 4 minutes, cold mitten friction for 30 seconds, and just keep on going. When you've got a good bit of sweat beading up on the forehead or around the nose and upper lip, that's a really good sign that your treatment's going well. When you're ready to take your last fomentation pad off, you want to make sure you do the full body cold mitten friction. So take the chest pack off first, do your cold mitten friction there, and then just cover each limb individually and just do your cold mitten friction over each of the limbs. So starting with your arms, then you get the patient to sit up, do their back and take away the heating pack from the spine. And then you'll work down to the legs and take the foot bath away and do each of the legs individually. Make sure the patient doesn't get cold after the treatment. Pop their socks and slippers back on. Make sure they stay nice and warm and go to bed to have a rest for about 1 to 2 hours. All right, so there we have it. That's hot fomentations to the chest. And the disclaimer that I forgot to mention at the beginning was that at the end, you will have a truckload of linen to wash. But hey, the treatment is entirely worth it.
Okay, I hope you found that informative. That was an example of what we call a revulsive fermentation, where you combine multiple treatments, the cold mitten friction, the hot foot bath, plus fermentations. It's sort of what I would call a go-to treatment. It's definitely more intensive and involved than a hot foot bath, but it's sort of like a treatment that I would utilize for a variety of conditions if I wanted a more intense treatment than just the basic hot foot bath, because you've got this heat here, heat in the back, and then you've got the cold mitten, the whole. It can be very physiologically stimulating, right? And help with many, many health conditions. So that's one of the reasons I wanted to show you that. Now, one of the simple parts of that treatment was the cold mitten friction. And this here increases white blood cell activity and antibody production. It builds resistance to colds and flu, and it reduces fever if done carefully so patient doesn't chill. Stimulates the muscular, neuromuscular turn, vasomotor tonic, controls blood vessel diameter, increases the rate of blood flow to the skin, turns and the circulation, skin tone and circulation. Note, now room temperature should be, as I say, comfortable, 75 to 80. Patient's feet must be warm and only expose one part of the body at a time. This is what we do with the cold mitten friction. Now, convalescence after fever, hyper or hypothyroidism. So if the thyroid is out of balance, you can use the cold mitten friction as a tool for helping the body get back in balance. Nervous exhaustion, depression, sluggish circulation, general weakness and lack of endurance as a tonic. You know, people, man, I just don't feel myself. You know, cold mitten friction could be a really, I mean, I don't feel, you know, I need a tonic. I need something. Do I need vitamins? Do I need this? Well, one of the most effective tonics is the cold mitten friction. All right. And You saw the example in the video clip, right? And we're gonna give you a chance to do an example of that particular one. Anemia, alcoholism and drug withdrawals, insomnia. All you need is ice cold water. Isn't that amazing? A basin, well, we're gonna get to it. Okay, if you're already chilled, these are contraindications. Reasons why you don't use it. Skin lesions or sores, eruptions, fear of being cold. Children and aged cannot tolerate cold well. Pleurisy or bronchitis, kidney stones, menstruation. Okay, procedure. All right, do one part at a time, extremities first, chest, then back, keeping all other parts covered. And we show that example, and you can see in this picture, this nurse has mitts on, and it's probably at the end of a heating treatment. This is actually at a sanitarium, one of the centers they used way back in the day when your nurses would do more water therapy than they do today. Keeping all parts covered. Wring the mitts quickly from the cool water. Rub the part vigorously, 5 to 8 seconds. Quickly cover the part with the towel and dry with friction rubbing. Okay. Okay, so we do one part first, and then we cover it, and then we expose a second part. Now, the tonic or stimulating effect depends on the temperature of the water. Repeat dipping of mittens 1 to 4 times. The duration of application and the vigor of friction applied. All right, the more vigorous you are, the colder it is, the more intense the reaction. Okay. Okay, of course, blood flow is greatly decreases at first, but then greatly increase with exercise. Oh, beg your pardon, sorry. All right, so that is the cool mitten friction. All right, now I'm going to demonstrate that, and that's what we're going to do. But I'm going to go through the 3 treatments we're going to do. We're going to do the cold mitten friction. We're going to do the ice massage, and we're going to do the contrast bath. All right. But I'm going to go through all of the treatments with our the PowerPoint. And then at the end of that, I'm going to just make a little brief adjustment so that you can see me and so that you can get yourself ready. You should have, at this time, your 2 basins. You should have your ice. You should have your cup that has the frozen ice in it. Okay, you probably don't have to bring the ice out quite yet, but you've got your ice ready. You could have your water boiled, okay? So you've got, like a kettle full of boiling water. And so that could be turned off, but you've got your kettle of boiled water. And if there's someone else that's going to assist, that's perfectly fine. So you've got your towel, and you've got your hand towel or hand or face towel. You've got your larger towel just to dry off your area. All right. Okay. Cover the area and proceed with the next part. Okay, we talked about that. All right. Now, ice massage. Now, this is another technique. As you can see in the picture, this is a foam cup, and the top part of the cup is peeled away. And so the person is actually holding on to the foam. And then they have the ice, which makes contact with the body part. Okay, so First of all, blood flow is greatly decreased at the first, but then greatly increased with exercise after the massage. Indications: painful joints, painful muscle, acute neck and lower back pain. So ice massage is used principally for pain. Method: you can use a foam or paper cup. Caution: patient is cold, painful shoulders or stroke, rheumatoid arthritis, and any condition where the use of ice intensifies the painful condition. Now, there are some people who may have pain who do not tolerate cold very well. So there are two options. There is heat, and we talked about that with fermentations. So hot fermentations can help with pain, just like an ice massage could help with pain. So if very cold intensifies or makes the condition worse, then heat is what you want to use. Okay, so keep that in mind. Now, procedure: do not prolong or rub directly over a bony prominence. Okay. When treatment is to be given on the back, have the person lie on the stomach with one pillow under the abdomen and one under the feet. Tear back the cup from the top to expose about 1 inch of the ice and rub ice in a massaging motion over the painful area and a little beyond it on all sides. So you understand, you see where we're coming from here. So we're rubbing this in circular motion, the ice over the area. You peel back, and that's what you will do, about 1 inch, and you're massaging beyond the area where the pain is, as well as the painful area itself. Now, at first, rub your left or right hand alternately with the ice, taking one stroke with your bare hand, then a stroke with the ice to reduce the shock of the ice on the skin. So you rub a little, and then you put your hand, and then you rub again and put your hand, okay? And rub with your hand, then the ice. And that helps to reduce the shock. So now there are 3 stages, actually 4 stages. Cool, uncomfortable sensation. That's the first stage. The second stage is burning. The third is aching of a short duration, and then relative numbness. Okay, so those are the 4 stages. So if you're wanting to help relieve pain, you need to go through those 4 stages. All right, so that's our ice massage. So we've gone over the cold mitten friction, and we've gone over the ice massage. Of course, you can end with resisted exercise after you have done the treatment. So hot and cool contrast. Now, this is also a very powerful treatment. Indications: infections in the extremity. So if someone has an infection on their hand, on their foot, or what have you, you can use this as a tool for greatly increasing the healing time. Sprains, strains, swellings, trauma after 24 hours. For the first 24 hours with a traumatic trauma, where there's swelling, we would use ice and very cool, maybe for like 15 minutes, then take it out, let it warm up for an hour, then another 5, 10, 15 minutes. It can also be used for fractures, for arthritis, edema. These are all examples of, okay, so you've got the bath. Obviously, it can be contrasted with using fermentations, where fermentations are hot, then you have cool, right? Between, you're still creating this contrast. If the area can't be submerged, you can use fermentations where it's a cold wrap and a ice wrap. You can use showers where there's a contrast shower, and you can even gargle. Okay, so these are different methods of doing hot and cool. Speeds up healing. Okay, this is an important tool for healing. Of course, if sensory impairment, they don't sense, they can't sense how to cool. You really want to be careful with that. Vascular compromise, poor circulations, diabetic complications. They have diabetic complications. They don't have feelings and all of that. You need to be very careful, and you probably don't want to do these extreme contrasts. Okay? All right. So for arms, hands, and lower legs and feet, you will use 2 buckets. One for the ice water and floating ice, and the other for hot. So you have your 2 buckets, your 2 basins that you have for today. One basin has the ice in your basin. It'll be ice and water, and your other basin will be for your hot water. So you can put sort of a warm water or slightly hot water halfway the basin or bucket, but on the side you're going to have the boiling hot water, the water that was hot. Okay, and so you would just add heat to tolerance so that you get it nice and hot where it needs to be. And then you would submerge your hand in that water or the foot, etc. Okay, so you go from hot to cool, hot to cool. For our example, we're going to use just the hand contrast. Okay, so the hand will go in the hot water and the hand will go in the cool. All right, in the cool mitten friction, you're going to use the wrung out cool water and then cool, and then you're going to friction your arm. Okay, and then you dry that off. So that's what we're going to do. And so the contrast, and then the ice massage will be the same idea. Okay, so that will be applied on your arm. So everything will be done up so you can use your arm for doing that. Okay, now the temperature of the water do not go above 115 for general population, or 103 for people who have vascular disease, peripheral vascular disease, for circulation or diabetes, etc. All right, now begin hot at a lower limit of tolerance and increase to maximum. So we always start out at a lower tolerance, and as time goes on, you increase. Even within the treatment itself, you can increase the temperature as you go along, and we are adept, and we are able to handle hotter and colder as the treatment continues, and as we have additional treatments, if it was like twice a day or once a day. Okay, now make 4 to 8 changes of hot and cool applications, 3 to 4 minutes hot water bucket and 30 seconds to 1 minute in the cold water bucket. So here we have 30 and 3. 30 and 3 is sort of what I like to do to remember. 30 seconds is probably fine. And if you really feel it's kind of cool, 15 seconds, that'll be fine also. Okay. So you end with cool, except for rheumatoid arthritis, which we end with hot. All right, so those are some examples with cool. Now, an additional hot water throughout the treatment to keep the hot water from cooling down. Okay, dry thoroughly and rest after each treatment. You can use disinfectants in buckets used for treatment involving open wounds, if that's the case, with someone who has some foot infection or something of that sort. Okay, this is for sore throats. For sore throat, gargle hot and cool water every 4 hours. Salt, vinegar, cayenne pepper, baking soda, golden seed powder can be added for added benefit. We're gargling and then we are spitting that out. Okay, so you got your gargle, hot gargle, you got your cool gargle. All right, you got your hot gargle, you got your cool. Same contrast idea. Shower. This will improve the efficiency of the immune system. Vigorous tonic stimulates metabolism as a refresher after local or general heat application. When debilitated by sedentary living, to relieve fatigue. Yeah, feeling fatigued, like you lost that zest. You just don't feel like you got that pep, that get up and go. Well, a good hot and cool contrast shower is something that will really help in that case. All right. So here we go. So you increase the temperature tolerance to tolerate the heat, maybe as high as 110. Usually we're not able to identify how hot it is or how cool it is. So we just need to sort of adjust what we can do. In a treatment center, however, we have a thermostat. So we can determine how cool it is and how hot it is. So going from cool to hot. So start with a cooler and then increase to a warmer. Now, hold at this point for 1 minute and quickly lower the temperature by turning off or down the hot water. Hold for 30 seconds. Reverse to hot according to tolerance for 1 minute. Again, turn the hot back off and hold as a cool temperature as tolerated for another 30 seconds. Okay, make 3 complete changes. Then the last period, after you've done these changes, minutes, hot and cool, then from the last period of heat tolerance, which again is 1 minute, gradually lower the temperature to neutral. It's sort of like not hot, not cool. And hold for about 1.5 minutes and then change to cool for 30 seconds. So that's sort of comparing, getting yourself prepared for finishing the treatment. Okay, now that we've gone over all of that, what we're going to do is actually go to our treatment. So you want to make sure you get all your materials in order. And I'm going to get set up to actually do this treatment. And so I have someone that's going to help me get together, and I just need to see your video of the presentation, so I make sure that when they're looking at me, they see me totally. So just bring your thing down. Now I'm gonna get myself ready. Bring the phone down here. Okay, so we have our person to help. My wife, Dr. Rosamond Gibbons, she's just going to bring her phone so that when we look to see, we make sure that I am in the screen. So as I'm getting ready, I encourage you to get ready, get your buckets together, your ice together, your towels, and your buckets. Okay. Okay. I just need to be able to see myself on your screen. Okay, everybody see me? All right. All right. Okay, everybody got your buckets. And let's see, what we're gonna start with is, I'm gonna start with the, okay, I got my little basin here. And we're gonna start with some ice, okay? And okay, I got an extra ice in the refrigerator. There are 4. Did you get the other? Just 2. Okay, there are, well, okay, 1 would be fine. Okay, now. We're going to start with the ice massage. And the purpose of the ice massage is actually to help with pain. All right, now I did not follow my own instructions. I have a plastic cup, but it will work with this example. And so what we need to do is, I'm actually going to use a towel, all right? Because I didn't have my paper cup. So I've got my ice, okay? And now we're gonna use our arm right here, okay? And so we rub in circular motions, all right? So this is what you need to do. Now to lessen the intensity, we can rub it slightly. How is this? Kind of cool, right? It starts to burn, right? All right, so I'm not going to go through the entire stage where we get to numbness and pain and all of that, right? But you got my point. So it's this rubbing action and circular motion with the ice. And this is for pain. All right, you keep going till you get to this place of numbness. And after that, and a number of people have experienced significant relief from pain. I mean, if you're in a place, you don't have a painkiller, or you tried the painkillers, they're not working, go to your freezer where you have your ice. You can have that plastic cups or paper cup just in your freezer, just for the time that you may need it for pain relief, right? Okay, so that is your ice massage. All right, then you just want to dry off the area. And in fact, the area will look very red or pinkish, depending on your skin tone, which indicates a very good reaction. All right, so here we have a simple ice massage. All right, so basically what you're doing is you're rubbing the ice until it goes through the stages of cool and pain to numbness. Rub between and keep going, and that is one technique you can use for pain relief. Now, you can take that ice and you can put it in one of your basins. And one of your basins should have ice and water in it. So you have ice floating in the water. So this would be very, very cool. And what we're going to demonstrate, I'll use the same, is what we call the cool mitten friction. Now, the easy way to make your own mitten is just to take 2 washcloths and sew them together, right? Now, this is an amazing tonic. It helps with a whole lot of issues, all the way to maybe even with hypo and hypothyroidism. And so what I have is not a mitt, but I just have a towel, and I just sort of wrung it out. Okay, then you take it, turn it over, all right. Then you take the towel, you give it a nice rub. All right, this is a very excellent tonic. Has the effect of waking up your nervous system. And if you're just not feeling yourself, like you're not 100%, you got someone to give you a cool mitten friction, your arms, the whole 9 yards. At the end of it, I promise you, you will feel invigorated, okay? So this is a very good treatment that you can utilize for a variety of problems as we have indicated. Okay, now, one of the most powerful of all hydrotherapy treatments is the contrast bath. And the contrast, if it's a shower, can stimulate your immune system. If you have an infection that involves your arm, your leg, or something, an area of the body that can be submerged in the water, this can be used. So now you have your 2 basins. One basin, you're going to put your hot water in. And so I have a basin here, and it's got sort of a normal temperature water, so that when I add the hot water, that is hot. Okay, so we have, this is our kettle, okay? Hot water. We have our basin with added the hot water to the basin. I think I'm going to use the bigger basin. And what we have is 2 blocks of ice, 2 cups of ice that I've added to the water. We do have another one in the fridge too. That's why I'll get it. So we have ice floating in 1 bucket, and you have hot water as hot as you can stand. Now, if you don't have diabetes, you don't have circulatory problems or anything like that, this is quite safe treatment. Obviously, you could start with actually not as cold and not as hot. All right, so cool and warm, and you can gradually increase the temperature. So we talked about this whole idea of 30 seconds, cool, 3 minutes hot. And that's an easy way to remember. 30 seconds, 3 minutes hot. 30 seconds, 3 minutes hot. Okay, so we got some more ice. We probably don't need that one. Looks like we're running out of water. We can add just a little bit more water. Just just regular water. Just add a little bit more so that should be fine. Okay, so this is our contrast. And so I'm just gonna add a little bit more water to the ice basin here. And our hot water is starting to cool down a little. So now every about 3 minutes, you would add starts. Every time we do the exchange, let's say we're starting with 3 minutes hot. When we go to the cool, that's actually the sign that it's probably ready to add more hot to the other side. All right, thank you. So what we do is, so we're gonna start with let's start with the heat. Okay. Take that. Okay, are we ready? All right, I'm gonna do this myself. So I have the I'm gonna put my hand in the hot water. Okay, so the idea is to do that for 3 minutes. And so if you're ready, let's do it. And I think I'm too hot. Just a little. I'm going to put a little bit of my cool. Okay. So I've got my hand in the hot. So what the hot is doing is dilating or opening up the blood vessels. And it's actually awakening our immune system. And anytime you present the body with extremes of hot or cold, it mounts a reaction to counteract that action. And in fact, so your white blood cells wake up as you are actually applying this whole procedure. So the heat attracts the white blood cells, increases circulation significantly, and prepares the body to fight whatever infection that may be in that particular area. Hopefully you're doing well. And what I'm going to do is just going to add a little more hot to my water. If you have no health issues, the hotter you can take it, the better it will be for you. Ultimately, the contrast that intensifies the reaction. Now I'm going to go to the cool. Now, sometimes staying for a long time is something you may find a little unbearable. So if it's less than 15 seconds, that'll be okay. Say, I'm going to cool now. Now, because my hand was in the real hot, the cool doesn't even feel as cool as it would have felt had I not had my hand submerged in the ice water. Okay, it is getting cool. I've got 2 large ice cubes here. All right, I'm getting back to the hot. And now the water in the hot is actually cooled down. And so I'm going to add some more water. Now what you would do you were doing it for someone else, you would put their hand or their feet or what have you to the side, and you would start slowly adding the hot water while you're mixing it. And the whole idea is to, okay, let me know when it's hot enough. All right, and they say enough, then you stop adding the water. If, of course, they are diabetic, you're gonna base it on the temperature, okay? And so here we go, all right? All right, they don't have to see in there, that's fine. All right, now I'm gonna go back. Now, let's hold it for a little longer. Now, the way you know it's a good reaction is the coloration in the skin, right? It's very red or pink. And that lets you know that there's a good exchange of blood and what is happening. And actually the cold helps to intensify the whole reaction. And the white blood cell count, the speed at which the body heals. I'm going back to the curl. This curl feels good. All right, so we got hot, we got curl, we got hot, we have curl. So any infection, any swelling or something. Now if you just get bumped, and then there's trauma, and then there's swelling, and there's heat, spraying or something like that, you want to just apply heat for the first curl for the first 24 hours. And then after that, you can do the contrast, as I shared earlier. Okay, I'm going back one more time with the heat. I'm going to add a little bit more of this hot water. All right, so these are very simple treatments that you can perform at home. You don't require a lot of equipment. You do require more like towels and blankets like that if you're doing the more like the fermentation, like demonstration we saw online. I mean the video clip. And however, most treatments you can do at home. In fact, most of the treatments that are done at lifestyle centers could actually be done at home. And that's the beauty of these natural remedies, that they have the capacity to produce significant health benefits at little cost to us. And it's just how wonderful the God we serve is, that he puts within our presence those things that can promote healing at the least cost to us. There's sunlight, there's fresh air, there's exercise, there's water, there's the food that we eat, all of them working together to make us and to keep us whole. And of course, trust in divine power, the one who works in and through these natural means to bring about supernatural results. Okay, going to go one more in the cold. And that's what we end with in this treatment. We're ending with cold. Okay. All right, then you briskly dry off that area. And now you've got this rich, you couldn't see the difference, but this is an example of very effective hydrotherapy procedures. The contrast bath, the ice massage, and the curl mitten friction. And we also demonstrated, we also shared with you the fermentation and the hot foot bath. And in the fermentation demonstration, they also did a hot foot bath. So you saw an example of the fermentations, the hot foot bath, the contrast shower, bath, hand bath, and ice massage, and curl mitten friction. I hope you found this time together informative and useful. And the best way to know how these things really work is to apply them. It is our goal that sometime in the future, we'll be able to actually do some hands-on styles where people can actually, have assistance as we go through a training exercise in natural remedies and how you can apply them. Look out for the future. We'll see how things go with all COVID, and when these things lift, we're looking at maybe a part 2 where it's more in-person, hands-on learning experience in applying the natural remedies. Thanks again for coming and being part of our section this week. We look forward to seeing you again next week, which is our last session. We're going to talk about rest and balance and trust in divine power. And the following week, we'll let you know exactly how we're going to do it. But we want to have some sort of a graduation, and you'll get your certificates. But you need to, after next week, you have all of the, fill out all of the questions. Everything will be finished. And then that's when we want you to send in your final report, which indicates all of the sessions and all of your scores. And once we got that information from you, we can make up the certificates. So we'll have the certificates ready for you. And we'll talk about how you will get those certificates and our graduation online service. So thanks again for being here and being a part of this demonstration on hydrotherapy. And let's pray to close this meeting. Heavenly Father, we thank you so much for this time we've been together and what we've learned about these simple water treatments, powerful yet simple in their application. Help us to practice and put into practice and utilize these tools for the benefit of ourselves, our families, and others who could benefit from these simple home remedies. In Jesus' name we pray, and for his sake, amen.